For a session produced by our underwriter, Bristol-Myers Squibb, please welcome its chairman and CEO, Giovanni Caforio, here with Forbes senior editor, Matthew Herper.
So that was really inspiring. So you've presided over a revolution, Giovanni. The Nobel Prize in Medicine was just awarded for two innovations. The discovery of one immune protein that's blocked by drugs called PD-1 and another called CTLA-4. The first drugs to target both of those were developed and launched by Bristol-Myers. And we've seen some amazing results from them, particularly in how long patients live. Now, you've been in the drug business a long time. How has this changed your perspective on what you're doing? How have these drugs changed you?
Well, thanks, Matt, and good morning, everyone. I would say in a very profound way, because for us, we've really been privileged, in fact, in participating in the front line in the revolution that immuno-oncology has been over the last few years. And we've seen how patients have benefited from a new approach. And what we've seen is long-term responses and long-term survival. And really, the fact that patients are beginning, in many cases, to have a normal life again during therapy and then after therapy, if they are responders and they're long-term responders. So for us at Bristol-Myers Squibb, it's really created a sense of urgency about helping as many patients as possible and then continuing to really work for the patients that are not responding yet. The sense of urgency has never been greater. In fact, we just heard from Judy, and we made a decision that we are always going to have patients in our meetings in the company because they remind us, first of all, why we do what we do, how important it is, all that we are accomplishing, and how much there is still to be done. So we are as focused as ever.
So how does that change the discussions on your executive team when you talk, when you start with a story like that, or a story from a patient who's had an amazing response to a combination of your drugs? How does that change the discussions you have in the boardroom?
So I think it helps us really work together like never before, and that's true inside the company and outside the company, because what we realized over the last few years is that innovation is moving at a speed that we had not seen before. And so that requires us to think about collaborating in a very different way. Of course, that's true across different parts of a large biopharma company like Bristol-Myers Squibb, but it's also true in terms of how we think about collaborating with patient advocacy organizations, academic institutions, providers. And so we've changed our perspective from working in our labs to thinking about us working in the middle of an innovation ecosystem where we can move innovation much faster and more collaboratively than we did before. And as an example, we made a decision to move one of our research discovery facility in oncology in Cambridge, Massachusetts, because we wanted to be in the middle of that innovation ecosystem. And we are going to be dedicating that facility, which opens later this month, with more than 300 researchers to the issue of resistance to current immuno-oncology agents, because there are so many patients that are not responding yet that we want to find a solution for them. We've gone in a place where we think we have a unique opportunity to collaborate with an outside ecosystem and of innovation, and we're taking our researchers there to work together and much more broadly.
You know, one of the first meetings I took as a reporter at Forbes was with a company 18 years ago. It was with a company that wanted to use data to change drug discovery. It didn't work then. What's different now? Because I'm hearing this from a lot of CEOs, and you guys, I just wrote a story about some of the stuff you guys are doing with partners to figure out how to use patient data. What's different about this moment from the other times when we thought that digital was going to change the way pharma research works?
Well, I think, first of all, let me say, I think it's still work in progress. We're not there yet. I think the data out there is still very fragmented, and it's difficult to aggregate. However, there are more and more companies that are aggregating large data sets, and now we are able to look at significant number of claims data and patient data longitudinally to understand the natural course of some types of cancers and diseases. So I think that aggregation is happening more and more. Obviously, computing power has increased. The speed at which we can manage very large sets of data is increasing. I would also say that regulators have become much more open to real-world data set. That's clearly true outside of cancer. We have a lot of experience in cardiovascular medicines where we're already using real-world data extensively, but it's increasingly happening in cancer as well. I don't think this is a short-term objective, but I think in the medium and in the long term, the use of technology really can accelerate drug development like it hasn't before. Remember, we used to organize our research and development efforts based on innovation cycles that were probably 10 years long. Now we are seeing innovation cycles shortened to 3 to 4 years, and standards of care in many diseases changing very rapidly. And so there is a need to bring the speed of our R&D efforts in sync with the waves of innovation that we have an opportunity to bring to patients.
Seeing drugs develop that quickly is really amazing. What surprised you the most about this journey, about these immunotherapies and your efforts to bring new drugs? What's been the biggest surprise for you here?
Well, I think the biggest experience has really been the relationship with patients. I have the privilege to interact with patients every day, and hearing from them, and it's the story of a 16-year-old boy with sarcoma that I stay in touch with in France, is the father of one of my daughter's friends here in the US that is being treated in the adjuvant setting for melanoma. Hearing patients tell the stories of how they've gone back to living a normal life, and in fact, how do they think about restarting a normal life and really enjoy the benefits of long-term survival has been extraordinary. And I think if you think about what has happened in the last 5 to 6 years, it's just extraordinary. At the same time, the feeling we all have is that it's just an incentive to move even faster with more energy and more determination, because we're very far from being done.
All right. Thank you very much, Giovanni.
Thank you, Matt.
Thanks to all of you.
Thanks, everyone. Thank you.